welcome to True Health Tuesdays. Today I'm fixing a screw up. Okay, last week, okay, honest to God, okay, I'm talking about inflammation and oxidation. Now, inflammation is a healing process vital to the body. Oxidation is how the body breaks down tissue in order to rebuild new tissue. And so I get in the car and I go, I didn't say anything about pain, because inflammation can cause, one of the side effects is pain. And what are the solutions of it? So, hence this talk. So we're going to talk about pain. Now, pain is a trip. I mean, when you find out how bizarrely ignorant the planet is, that a doctor would actually prescribe a chemical to alter your physiology so you're unaware of pain. Again, I'm going to show you how stupid that is right now. I mean, for one, pain stimuli inside of the brain affects the similar areas as pleasure. We're talking the reward circuitry. And I like this out of the Journal of Neuron. Our understanding of how pain is differentially interpreted by the central nervous system of humans has significantly advanced with the ability to image neural pathways and circuits involved in evaluating an experimental or clinically painful stimulus. When you look at this, how does pain affect the brain? And that's something that people are missing. You know, oh yeah, I hurt my back, I hurt my neck, how does that actually affect your physiology? And why do you want to solve it instead of just covering it up with drugs? Well, for one, if you got chronic pain more than 6 months, your brain literally changes its structure. So this isn't, oh man, I've hurt for years. It's like, holy shit, this pain is destroying my brain, it's shrinking. Okay, reduced cognitive dysfunction, okay, abnormal prefrontal processing, so that's impulse control. Chronic pain shrinks the gray matter by 5 to 11%. And if it shrinks that much, 6 months of chronic pain can shrink the brain as much as 10 to 20 years of normal aging. So this isn't something you screw around with. I mean, if there's a physician so ignorant that you go there with chronic pain and say, Doc, I hurt, and to provide you with a drug, it's beyond compare with ignorance. Okay, the longer a person has chronic pain, the more the brain shrinks. 1.3 cubic centimeters per year, diminishes quality of life, of course, anxiety and depression. And I like this. It's important to emphasize the importance of treating pain early and aggressively, or it will destroy the brain. Destroy the brain. And I mean, I know men have two brains, but you know, you still need to have, you know, it function. Okay, now what does pain do? And this could be anything, and we're going to talk about the 3 different factors of pain: physical pain, chemical pain, emotional pain. But it's going to put your body in a stress state. So we're talking elevations heart rate, dilates the pupil, shutting blood supply down to the gut, elevates blood sugar. I mean, just in these first few, couldn't you see that somebody with a subclinical chronic pain, they could be misdiagnosed with high blood pressure, high blood sugar, high cholesterol, digestive anomalies, poor sleep anomalies, increased LDL, changes in brain function, decreased memory. This is something very, very important. So now let's say you got pain. Okay, we're going to go over the physical, chemical, and emotional pain, but you got pain. So knowing that it can change brain function, knowing that it can alter every physiologic effect that you have. Can you imagine a guy that's paid to work on humans say drug it? It's beyond belief. So that's what they do. I'm sorry, this is called completely not common sense. This is bizarre. So we have an opioid narcotic addiction problem in America beyond what anyone could have ever even hoped for. So chronic pain, 14,000 people a year, and these are old numbers, 2014, die in the U.S. Now, when your prescription runs out, where do you go? You got it, Michael, Santa Ana, underneath that bridge. Okay, so this is one of the reasons the rise is a heroin. I mean, that we've got some friends from Mexico, and they're starting to grow opium fields down there. I guess now pot's legal here. Okay, since 1999, so we're talking a long time ago, quadruple prescriptions for Vicodin and Percocet, even though when you're looking at pain scales for the American, pain levels haven't really risen. But the prescriptions have quadrupled for pain-relieving drugs. How come, I wonder? Half of all prescriptions are for opioid prescriptions, 250 million prescriptions. Now that's like one bottle of prescriptions for each adult in America. I know, someone has mine. I mean, and when you look at the deaths for this, some people say 100 deaths a day, some people say 78 a day. The CDC, they're really on top of it. They say 40 a day. Okay, they just came out with new guidelines, okay, because you're talking between 40 and 100 people a day are dying from drugs properly prescribed, okay, for chronic pain. Now, they have 12 guidelines aimed at primary care doctors treating adults for pain. How, and again, when you look at this, these are guys that are paid to work on human beings. How could you possibly prescribe a chemical to reduce pain when it's going to negatively affect the entire body? We must act now. Now, side effects of the opioids, and this is just like taking them. You're talking constipation, dry mouth, upset stomach, but then we get into more lung and heart problems. Now, we get people in here on multiple pharmaceuticals. I mean, they've been hurting for decades, and they're shocked. They're shocked to find out that the drugs they're taking for pain relief are actually causing an increase in pain. I give them articles like this, and we work with them. New study, opioid benefits, okay, opioid painkillers, find that the drugs worsen pain rather than ease it. So if you're taking the Percocet, the Vicodin, the opioid, and you've been taking it for year in, year out, and you keep wondering why this chronic pain is there, it's actually making it worse. In a subject trial, comparing the non-treatment group, the team found chronic pain of the morphine group was worsened after just 5 days of treatment. And this is, what's more, this effect persisted for several months. So if someone's taken an opioid for just 5 days, it can hypersensitize their system for months. We are showing the first time ever that even a brief exposure of opioids can have long-term negative effects on pain. We found the treatment was contributing to the problem. I'm thinking, man, what a great drug. You know, first you take it for pain, it makes the pain worse, and it's addictive. Ka-ching, right? That's sick. Man, we can't do that. I mean, overuse headaches, or overuse medication headache, journal, joint, and face pain. And this isn't just the opioids. We're talking almost everything. The more that you use it, if you're taking a drug, or you know someone that's taking a drug, check the bottle. You know the side effect of muscle relaxants? It's muscle spasms. The side effect of the antidepressant drugs? It's suicide and suicidal thoughts. The side effect of the sleeping pills, what is it? Fatigue. Lack of sleep. Okay, I mean, okay, now, typically, say you're taking pain relievers, opioids for, I don't know, wound, okay, damaged tissue somewhere. Turns out that it weakens your body's ability to heal. Published in Wound Repair and Generation, the data suggests that opioid exposure is associated with reduced likelihood of healing patients with chronic wounds. It ultimately affects wound outcome. So yes, there was a study back in the 90s in an orthopedic ward. Okay, so these guys had fractures, and they found out that ibuprofen actually limited the cells on the bones that laid down new bone and actually healed fractures. I mean, it's mind-boggling. Now, luckily there's some safer, more natural alternatives, because honest to God, nobody wants to suffer with pain. If you've had an acute injury, and I got to tell you, when I was run over by a car, I'm laying in there, both legs broken, sternum fractured, skull fractured, front teeth knocked out. They gave me a shot of morphine, and it was wonderful. Okay, and I thought it was just like the greatest thing in the world. I wanted the second one really, really bad, you know, because I was hurting. And the third shot, I swear to God, I didn't need it. I just wanted it. And this is like my first day in the hospital, okay, after I was run over, and I never got a fourth shot. And the nurse is coming up saying, you know, it's time, you can have another one. No, man, I'm good. Because it scared me. It felt so good. So I can understand the addiction. But what about something safer? Cannabis. Okay, thank God it's medically prescribed now. But what about things that people think are benign? Like Tylenol. Oh, it's just over the counter. Tylenol's you're talking 56,000 people go to emergency rooms every year. That kind of tops the old opioid, 40 people, a day dying. This gets worse. It's the leading cause of acute liver failure. It's the deadliest drug in America. And when you look at it, glutathione protects your immune system. This Tylenol actually depletes your body's ability of glutathione, and impaired endogenous antioxidant defenses. That's what acetaminophen or Tylenol does. It weakens your body's ability to regenerate tissue. I mean, how could you possibly prescribe that? 540% increase in asthma risks, toxic epidermal necrosis, twofold increase of blood cancer. These are all really way worse than a headache, right? Yeah. Okay, way worse than joint pain. It's mind-boggling. And then, just like the opioids decrease wound healing, these decrease your body's ability to regenerate cartilage. Okay, so if you're taking it for joint pain, it's destroying all the cartilage in your body, the proteoglycan production. And I love the Journal of Hepatology. Its benefits are said by the Food and Drug Administration to outweigh its risks. It still must be asked, is this amount of injury and death really acceptable for an over-counter pain reliever? No. What's that quote? Do no harm? Yeah. Read the oath, man. I mean, and we're talking not just, I don't want to just bag on Tylenol and the opioids. Let's hit on all of them. The non-steroidal anti-inflammatories, the ibuprofen, Motrin, Aleve, 40 to 60% cardiovascular problems, hearing problems, GI problems, congenital heart problems, miscarriage, 80%. Atrial fib. I mean, it's not safe. Kidney damage, skin damage, cardiovascular damage, gastrointestinal damage. And this was fun. You see in Medscape, because I read these journals all the time, and you get these articles that you think, my God, how bizarre. And this is the title of a study coming out. Non-steroidal anti-inflammatory drugs may prevent Alzheimer's disease. And I'm going, holy moly, I know the chemical reactions. I know how it affects the body. So you're going to die of gastrointestinal bleeding? Okay. But you might prevent Alzheimer's. So let's check the study. So they do the whole study. Bummer results. Contrary to the hypothesis that nonsteroidals protect against Alzheimer's disease, pharmacy defined heavy nonsteroidal anti-inflammatory users showed an increased incidence of dementia and Alzheimer's disease by 66%. Okay, but how many people are going to look at the title of the article, okay, and not look at the study, or it's going to be on the 7 o'clock news because the 7 o'clock news is sponsored by, Wyeth Pharmaceuticals or Merck, and they say, yeah, man, we're doing a study that shows that these nonsteroidals will prevent dementia and Alzheimer's disease. Okay, makes me want to go out and buy it right now. But then I see this, a 66% increase, bummer. And then you're talking about nonsteroidals also increasing heart attacks. Now Vioxx. The Vioxx is back on the market, so you don't need to worry about it. Okay? Okay, honest to God, this is the most psychotic thing. If the American public has ever had greater proof of being just lied to, approved by the Fraud and Deception Association in 1999. It's gentler and safer on your stomach, real bad for your heart.
What is it?
Wait, gentler and safer on your stomach, but real bad for your heart. Okay, well, they didn't find out it was that bad for the heart. Okay, they knew it was better on your stomach until 2004. Then the total starts racking up. You get 40,000, 27,000. Then it's 40,000 deaths from a pain reliever. Now they're not quite sure because they settled out of court, for, I think it was like $315 million. It's between 60,000 and 100,000 deaths from Vioxx. But it is gentler on your stomach, so they decided to bring it back on. Now, when you're reading the articles, because this was already approved. Okay, it was approved by the FDA, and you read the journal articles, and they're comparing it with, I think it was naproxen, okay, something similar at the time. And they said, oh my God, this is amazing, it's gentler on your stomach. And the quote from the journal article, overall mortality rate and the rate of death from cardiovascular causes were similar in the two groups, naproxen and Vioxx. They lie. They lie. They hide data. This is like not just insidious, it's criminal. More people died from this drug than died in the Vietnam War, and not one person went to jail. And now it's back on the market.
How's it possible?
This is America, okay? There is no more uncommon sense. There's very few countries in the world, I think there's only like 2 left, that have DTC, direct-to-consumer advertising. So ask your doctor if this is right for you. It will help with your pain, and it's gentler on your stomach. And if you're in friggin' agony and you actually think this medical system is appropriate, you're going to go in there and you're going to say, Doc, I heard of this. Vioxx is back. I know it killed a bunch of people, but I'm probably going to be okay. I want the relief. Journal of the American Medical Association, Celebrex, no safer than any other pain medications. And this is weird. This came out the year before Vioxx was pulled off the market, out of the Journal of Spine. It turns out that going to a chiropractor, despite the fact that chiropractic far outperformed both Vioxx and Celebrex, over $3 billion was spent on the 2 drugs. Further, an 18-month study with the chiropractic group was stable, and the Vioxx group, the drug was removed recently because of the heart attacks and strokes it was causing. So they did a study, 18 months long, comparing a chiropractic adjustment with Vioxx and Celebrex. And I mean, knowing now, okay, that these things actually increase pain, they damage your tissue, they damage the heart, it's not a fair comparison. Because what's the poor chiropractor doing? He's taking pressure off the nervous system, allowing the body to heal naturally. So let's look at pain. We know it affects the brain. Okay, we know it negatively affects the brain, but how does it affect the body? Remember that list of things, the elevation in heart rate? Let's look at how the body works. So if you have pain, we can actually find appropriate solutions. Let's like respect the body, that it gives symptoms for a reason. Now the problem with this is 90% of the nerves that come off of that spinal cord, there's no pain fibers. You don't know. Pain is the end result of a symptom. It's mind-boggling to think that, oh my God, pain we should give a bunch of drugs for. But we've got 2 halves of this automatic nervous system. Parasympathetic, the rest, digest, and repair, that regenerates tissue. It's also known as craniosacral. The other part is the fight or flight. When one part's up, the other's down. Okay, now I'm going to show you how to measure this, but if there's an imbalance of those systems, because we need both the systems. The parasympathetic is generally active at night, the sympathetic is generally active at the day, but we need those balanced. Okay, now what's amazing, I got this picture out of a book, actually out of a slide that I took on a seminar. And this is showing a macrophage is one of the most important immune system cells ever. Now, these cells communicate through the autonomic nervous system. Afferentation means sensory input coming up. And they have the sympathetic nerve supply going directly to the immune system cells. So this system, the nervous system, controls and coordinates directly every function of the body, including the cells that respond to immune system or pathogens. I mean, it's amazing. So what stimulates our autonomic nervous system? We got 3 stressors, physical, chemical, and emotional. The trip is the body responds the exact same way to all 3. You're talking about the opioids that are given for chronic pain. Okay, that could be a wound. It could be an emotional wound. It could be a physical wound. It could be a chemical wound. Okay, so how does the body respond? Well, first, you get that autonomic response, and the fight or flight mechanism goes in. Now, you have this gland on top of the adrenals called the pharmacy of the body. Okay, they produce every glucocorticosteroid, mineralocorticosteroid, and sex hormone. Now, people in chronic pain, they're going to end up with adrenal fatigue. They're going to end up with a low-functioning thyroid because you got this balance. You got this balance of the metabolic activity. You've got the thyroid that's going to be up and the adrenals are down. If the adrenals are up, the thyroid's going to be down. So you got this balance. So what do people in chronic pain present with? Chronic adrenal fatigue. And then you go to a naturopath and they give you supplements or herbs, or you go to a moron doctor and he gives you, steroids or something to shrink the swelling of tissue. Stress and adrenal fatigue. These are clues that the body is under chronic stress. Not a problem. They're clues. The body is responding correctly when you have autoimmune diseases because you're under chronic stress. It's responding correctly when you have low blood pressure. It's responding correctly when you're depressed or nervous. Do you understand? These aren't diseases. These are the body responding to chronic stress. If you try and treat the symptom, the body doesn't get better. They get sicker. And if you're in a society that covers up symptoms with drugs, it's like, God, that's stupid. Okay, now stress in the thyroid. Remember, if you've got chronic stress, how many women today are misdiagnosed with a low-functioning thyroid? You're talking about 30-40%. And it's just not needed. Because if you have physical, chemical, or emotional stress, the adrenals are going to be firing and the thyroid's going to appear low. Low-functioning thyroid, chronic fatigue, fibromyalgia. We already know fibromyalgia is listed as an oxidative stress response. Cortisol, and again, this is secreted by the adrenal glands. They need cholesterol from the liver. This is one of the most vital materials that your body creates to shrink the swelling in tissue and to help that oxidative process. But if it's chronically elevated, increased blood sugar levels. Can anyone say pre-diabetic? Okay, decreased protein synthesis, joint pain, wrinkles, okay, muscle wasting, osteoporosis. Oh yeah, we're not going to check your cortisol levels. We're going to give you Boniva. Okay, you understand? Now this is how we check the autonomic nervous system. These are 3 scans. They're called heart rate variability. On the left-hand side, you'll see that green dot in the middle, and there's a black line down the middle. Okay, on the left-hand side, that's sympathetic dominance. On the right-hand side, it's parasympathetic dominance. In the normal, the white dot is the reading. Normal should be middle of the green zone. That's normal. It means your autonomic nervous system is balanced. If you look at the picture on the left, that's a sympathetic dominant state. Sympathetic dominant, what's happening in his body? Does he have good blood supply to the gut or poor? Poor blood supply to the gut. Okay, now what's his blood sugar like? It's going to be elevated. What's his sleep patterns like? Terrible, horrible. Okay, they're going to have sweaty palms, poor sleep patterns, cardiac arrhythmias. Okay, but now, is the body responding correctly in that circumstance? Absolutely. This is what I tell the patients. I said, man, your body's in a sympathetic dominant state. It's like you're stuck in this trench in World War I. Bombs going off all around you. Okay, do you need melatonin to sleep when you're in a trench? No, you got to find the sympathetic dominance, or you got to find the sympathetic stimulus. Does that make more sense? So the body's responding correctly when it's under stress. You just got to find the physical, chemical, and emotional stressors. Normal's just normal. The most dangerous one up there is the low-functioning parasympathetic state. That means that your body cannot repair itself. It's breaking down, and low-functioning parasympathetic is the cause of most heart attacks, most cardiac problems. How do we know that? The Journal of Electrocardiology. Okay, what they're finding out is that the parasympathetic, a low-functioning parasympathetic, is the leading cause of heart attacks. So when we see that on the heart rate variability scan, it's dangerous. It's dangerous. Now, the parasympathetic nervous system, the heart, it's got 2 nerve supplies, okay? One, cranial nerve 9, the other one, cranial nerve 10. Now, these come out of the base here. So can you imagine someone that works at a desk or has direct trauma of that, forward head carriage, and a low-functioning parasympathetic state? It's flat out dangerous. We're going to cover more of that later, but what I want you to look at is See this person? This person is standing up straight and they have a huge 9-degree buckling at the top of the rib cage area. That's the sympathetic nerve supply to the heart. Okay, the T1 through T4, the top of the rib cage area. You can identify the rib cage area. Everyone's seen this thing on Halloween, right? It's called a skeleton? Okay, yeah. Well, bam, fix it. I mean, I know it seems too basic, but imagine if you respected the body, that it's given a symptom for pain, it's given a symptom for cardiac arrhythmia, it's given a symptom, and it's doing it because there's a reason. We're not going to be arrogant. What about sexual dysfunction? Do you know how many people I get with erectile dysfunction or relationship problems? And this is easy. Think point and shoot. That's how I used to teach it. Parasympathetic is for arousal. So what if somebody is a low-functioning parasympathetic, like on that right? What are they going to have? Gee, I don't have any desire for sex. You know, my wife doesn't love me, or she can't get aroused, or you know, we get aroused but you can't climax. Okay, why? Could it be an autonomic dysfunction? More than likely. I mean, there could be physical, chemical, and emotional stressors, but it's huge. Now, when you look at medicine, if you're respecting the guys in the white jackets, if you still have even a minimal amount of respect for drugging symptoms now, okay, please turn up your hearing aid so you can hear me. Okay, the vet task force, they're saying medicine at best is 20% right, and most of the time it's 96% wrong. Even teachers at the medical schools, they'll say, look, half of what they're teaching today is incorrect. They don't know what half. Okay, I mean, so let's solve the issue. So all of that was to come to solutions for pain. Okay, so we got to have the solutions. Now, the stressors, this is causing physical, chemical, and emotional pain. We've got to have the solutions for all three. So when we were talking about last week about inflammation, let's look at the free radicals. Okay, why is a food an anti-inflammatory? Why is an anti-inflammatory food good, but an anti-inflammatory drug bad? Well, inflammation is how the body is breaking down tissue, and you're breaking down tissue all the time. You're rebuilding an intestinal lining, you're rebuilding skin, you're rebuilding everything in the body constantly. You're building 1 billion cells a day. You're destroying 1 billion cells a day. So that process is called oxidation, okay, or inflammation. And what happens is you create these free radicals, okay, and those free radicals, they can damage other tissue. However, because the free radical, it's an uncharged molecule, it's missing an electron. So it's trying to attach to something. However, if you have antioxidants, okay, like glutathione or fresh fruit, or we're going to cover some of the antioxidants, these are substances that can give up a ton of electrons that inactivate those dangerous free radicals. And it allows your body to heal. So what kind of things form these free radicals? We're talking natural aging, stressors, injury, pollution, vaccines. God, that's a mental giant exercise. Drugs, poor diet. These, okay, now there's no negative effects from this so far, okay? We still haven't done our studies on green vegetable juices, but we found 1 quart a day is very good. I know. Think of this. Turmeric, blueberries, sweet potatoes, cruciferous vegetables. We have a sheet, and I should have given it to you too, because vitamin K is in dark green leafy vegetables. Vitamin K is also involved in clotting. There's some ignorant people out there that are saying, oh my gosh, you have cardiac arrhythmias. You have to stay away from green vegetables because they have vitamin K in it. And I'm going, wow, you know, at least give no advice instead of bad advice. You know, you don't say, drop that broccoli. You'll have a heart attack, for God's sake. Jesus, another vegetarian falls down. Will those guys ever learn? In-N-Out's right down the street. No, you know, I mean, it's like, are you serious? No, that vegetables are good for you. Just because it has that substance doesn't mean your blood is going to start clumping in the arteries. Okay, so let's look at it. Cayenne pepper for headaches. Why? It's a vasodilator. I mean, the neat thing And this one, just for muscle aches, don't do this if you have a cut. You only got to do it once and you'll know never to do it again. Okay, you mix a little bit of cayenne pepper in coconut oil and put it on your skin. It generates heat. It's fantastic. So if your wife is working in the yard too much, put it on her body. Okay, yeah, Sarah's not here, so I can say that. Okay, rheumatoid arthritis. You got these bones come together, was surrounded by a synovial membrane. The rheumatoid arthritis has these cells that are attacking it and destroying that synovial membrane. That's why the joints all fuse. Vitamin K, okay, knocks it out. It destroys those cells. It regenerates tissue. Talking vitamin D and vitamin K, grass-fed animal products, fermented foods, cheeses, amazing. You've got to optimize your gut flora. Why? Not just for pain relief. Respect the body. This is what your body needs to regenerate tissue. You need an organic plant-based diet. It's expensive. Okay, get the organic fruits frozen. Okay, you just can't eat it in our toxic environment today, conventionally produced foods. Coconut oil, fermented veggies, probiotic supplements, juice vegetables, blended fruits, raw dairy. It just makes sense. Turmeric for joint pain. And this is one of the most frustrating things because I just had a patient today. His medical doctor took an x-ray and says, wow, you have arthritis in your spine. He says, yeah, I'm going to my chiropractor to get it reversed. He says, reversed? Here, take this Celebrex. It'll make you feel better. And I'm going, buddy, you gotta come tonight. We're gonna be talking about that. But look at this, arthritis research and therapy. This strategy may support the regeneration of articular cartilage. Most doctors don't know that turmeric can regenerate cartilage. It means your joints can regenerate. So this means your body renews itself. Phytotherapy Research Journal. Turmeric, anti-inflammatory, antimicrobial, antioxidant, anti-neoplastic properties. Why? Because it's going to give up the electrons. It's going to help the body regenerate. You're giving the body the fuel to regenerate. Carotenines. Okay, we're talking potential anti-cancer, stimulate intercellular communication, protects your heart, brain, blood, everything. This is where you get that. So I'm not suggesting, some supplements are going to be vital, but by gosh, what about carrots and sweet potatoes tonight? A little bit of kale, a little bit of spinach, saute it with a little garlic. Oh, good God. So we've got natural pain relievers. Believe it or not, water is the best, but it's got to be healthy water. This is going to be on your list as well. Deep breathing. If you breathe out, you guys see the carbon dioxide? Okay. I know you did. You got the special glasses. Well, that's acid leaving the body. It's really cool. But most people don't do deep breathing throughout the day, but you're going to alkalinize your system just by deep breathing. Walking barefoot outside, that has an antioxidant effect. Skin on earth. Sleeping with a grounding sheet has an antioxidant effect. Fish oils, omega-3s, they have the EPA and the DHA. Flaxseed oil or seed oils do have omega-3s, but it's in very small quantity. So if you really got to get in there for pain relief, get the healthy fish oils. There's a list of pain relievers, but remember, I'm not advocating to cover up pain with an herb or a supplement. You respect your body. It's given symptoms for a reason. If it's a joint articulation problem, readjust it, restore the nerve supply, clean up the blood so you get healthy synovial fluid production, you regenerate the joint. Okay? It's really that simple. If it's a knee joint, look at our knee and foot health video. By God, distract that knee joint, cause inflammation, clean up the blood, you're going to regenerate the tissue. If it's back pain, neck pain, if it's an emotional trauma, God, reprogram the brain. The subconscious is programmed through repetition. You can do that. We got videos on it. Cayenne cream. Do not put that on a cut. Yes, I have done that several times, thanks. Okay, you find cuts you didn't know about. Okay, ginger, phenomenal. I mean, just put a couple of slices of ginger in water. That's really a nice way to finish the day. Butt swelly, bromelain, fresh pineapple. It's the season now. Go out, get some fresh pineapple after your wife's worked hard in the yard. So when we talk about the solutions for pain, they seem too simple. Okay, they really do. You got to get your nervous system checked. Why? Because that stimulates the immune system. It stimulates your entire system. You got to do regular exercise, okay? And this just means walking a half hour a day. If you're in an environment where you can walk barefoot, my God, that's so much better for you. On the grass or hard sand, because the earth does have an electronegative charge. Proper nutrition. You know, unless you're a medical doctor, you know, that's afraid of green vegetables, have a plant-based diet. I know. Okay. Sufficient rest. You got to have deep rest and prayer and meditation. Now, we do have, and this is going to be fun, we got our cruise talk coming up on the 14th and 22nd. There's still some cabins left, but we've got a great set of speakers lined up. And we're going to be talking how the body works, but we've got Dr. Tim O'Shea, who's a brilliant on vaccine science and how to detox your body. We've got Jaya, who's, I mean, amazing in breaking down problems with relationships. Mr. Purcella, who's head of American Holistic Care. Dr. McPhee, who's going to help heal your finances. And I'll be on there just documenting. It's fun to go in there, hang out at the seminar, because we only speak when we're at the ocean, on sea, and then hang out. We all have dinner together. It's fun, and all of this will be available on Dr. John Bergman. And then we got a bunch of references for the internet pariah who are going to say, "Well, that's not true. My doctor likes Tylenol." Now, any questions? Yes.
Inflammation, swelling, same thing?
Kind of. Inflammation is a healing process. Swelling could be a protective process. Like if you, anyone seen Jean-Claude Van Damme? Yeah, he's got a big impact injury right here. It's a little bit of swelling, and that's to protect from getting kicked in the head. It's from an old injury. If you ever, take close note of him next time you see him. Yes, ma'am.
What do you recommend for a 77-year-old woman who fell down? It's my grandma. She fell down and it was like her lower back that's in pain. It was 3 weeks ago. Right now she's fine when she's walking, but we take her to a chiropractor, and even when she tries to lay down, it's still hurting her.
Okay.
We've tried everything from turmeric to curcumin to essential oils.
Perfect. Have her stay away from heat. On an acute trauma of the spine or pelvis, have her get a trochanter support. Her chiropractor can call me. I'll explain what it is. You got to stabilize that. She has to put, when she's sitting, she's going to have some type of trauma. If the chiropractor did not take x-rays, she's got to get to somebody that is going to take x-rays.
He did take x-rays and they saw no sign of fracture or anything like that.
Okay, yeah, she's going to have an unstable pelvis if she fell on her low back and pelvis area, and that's a pretty easy fix. Stabilize the pelvis. Get her on huge amounts of water. Fish oil is going to be really good. But also have her watch the deep sleep. Because a lot of times if people aren't getting sufficient REM state of sleep, they're going to say, oh, the pain woke me up. And that's not true. There's a way to trick your brain to reset your circadian rhythm so you can get deep sleep and your body can heal. Yeah, and they can call me. Any other, and use ice and not heat. Now that's huge. You want to use ice on the spine and not heat. You're supposed to say why.
Why?
I'm so glad you asked. Okay. Well, because most spinal pain is from nerve swelling. Okay, and there's muscles that you don't have conscious control over that are in spasm. So doctors erroneously will typically use heat on the spine, and that relaxes the guarding muscle spasms, but that makes nerve pain worse. So I can't tell you how many times people have gone in and said, oh man, I let that hot water run on me, for 20 minutes and I finally could move. And then I go to dry off with a towel and it was like someone stabbed me. Same scenario, 20 years, I hear it every week, okay? Ice. What ice is going to do, it's going to shrink the swelling of the nerve and turn off the reason the muscles are firing. Okay, ice doesn't facilitate the healing, it's just going to make you more comfortable.
right away, or is it over the whole course of recovery?
You could do it. I mean, you're going to find out, because, I mean, we're spoiled. I mean, people typically are out of pain in like 3-4 days. So, you know, using ice for the first 3-4 days, it's okay.
Okay.
Yeah, using ice for the first 3-4 days, it's cool. So I had to. Okay. I know. Okay, but you know,
Give up your day job.
yeah, I know. Okay, but it doesn't facilitate the healing. So when people are sleeping on an ice pack or that's not making you better faster. Yeah, just
But it does relieve the pain.
it does relieve the pain.
That's what you're going for.
Yep. Yeah, but look for stabilization, and movement has better therapies. Movement is actually going to help those discs fill up with fluid. That's one of the things that she's probably not doing, the grandma. Yeah, and that'll help.